Futibatinib is a pan-FGFR inhibitor that has shown pretty good activity in FGFR-altered solid tumors, including in urothelial cancer. And there was a large phase 1 trial with an expansion cohort that actually, again, demonstrated this activity across multiple tumor types. This study was designed to assess the efficacy and also safety of Futibatinib, but in combination with Pembrolizumab in locally advanced or metastatic urothelial cancer. And specifically, this was a population of patients who had histologically confirmed urothelial cancer, were treatment naive in the metastatic setting, so had not had prior systemic therapy in the metastatic setting, and were platinum ineligible. So those are the important inclusion criteria for this study. Now, the rationale for combining an FGFR inhibitor and an immune checkpoint inhibitor, there are several. There is a preclinical rationale suggesting that, at least in preclinical models, that FGFR inhibition potentially enhances the activity of immune checkpoint inhibitors in urothelial cancer, among other tumors. And there have been other studies combining FGFR inhibitors with immune checkpoint inhibitors that have shown and demonstrated pretty good clinical activity. So this study enrolled actually patients both who were both selected for FGFR specific alterations. So that was cohort A of the study, patients with FGFR3 mutations or FGFR 1 through 4 fusions or rearrangements. But there was also a cohort B to the study, which included wild-type patients or patients with other FGFR alterations. So this trial, in other words, included both this biomarker selected or biomarker defined cohort and a wild-type cohort. The efficacy results that we saw actually, I would say, would be fairly consistent with what I would expect, at least in cohort A. That's the biomarker selected or biomarker defined cohort. Response rate was about 47%. Responses were seen both in patients with FGFR3 mutations and FGFR 1 through 4 fusions. Responses were durable and on average about 12 months. And median progression-free survival was 8.3 months, while median overall survival was not reached after median follow-up of 18 months. In cohort B, that's mostly the wild-type cohort, response rate was lower, 27%. We still see pretty durable responses because, again, this is a combination with a checkpoint inhibitor, so you would expect that to some extent. So duration of response was still about 14.5 months median. And then median PFS and OS were about 4 months and 18 months, respectively. I should also say that the combination was overall fairly well tolerated. About 40% of patients in either cohort had grade 3 treatment-related adverse events, but no grade 4 or grade 5 treatment-related adverse events were seen, which is very important. The adverse events we did see were mostly consistent with this class of FGFR inhibitors that Futibatinib, of course, belongs to, and that included hyperphosphatemia, dry mouth, diarrhea being the most common side effects. What we did see less of compared to some of the other FGFR inhibitors were retinal and nail toxicities. I should also say that most patients, or only a minority of patients, actually discontinued therapy due to toxicity. So our overall conclusion from this study was that although this is a more modest-sized phase 2 study, it does appear that there is activity of this combination of FGFR inhibitor and a checkpoint inhibitor that potentially should be investigated further in other trials and other settings in urothelial cancer, because the landscape, of course, in this disease has shifted considerably in recent years.